Hello everyone, this is Dr. Rahim, and today we are going to talk about telephone consultation. Telephone consultation is an important topic nowadays because in your exam you may find up to seven station as telephone consultation, 7, 6, 7, 5 station. Because of this pandemic, they bring a lot of telephone consultation nowadays. So first of all, we will comment on some important information you need to know about telephone consultation, and we will talk about the approach of telephone consultation and the approach of the station itself. In the beginning, any station can come in the exam as telephone consultation. I mean by that, telephone consultation could be medicine station, like the first presentation of the patient, like the patient is talking to you for the first time, he has some complaint, and you need to diagnose this patient to give a provisional diagnosis. It could come as counseling station, as breaking bad news station, as medical error station. It could come as any station. So first of all, you will apply the approach of telephone consultation itself, and after that, you will apply the approach of the station. We have fixed approach for counseling. We have approach for breaking bad news. We have approach for medical error. So first, you will do the approach of telephone consultation, and after that, you will do the approach of a specific station. But you have to put into your consideration some important notes. You don't need to miss this note because it is important in the exam. In telephone consultation, the patient is away. The patient is not in front of you. So you need to put this into your consideration. I mean by that, if it is medicine station, if the patient have pain anywhere in his body, so he will point to the area of pain, and you will see him uncomfortable. So you don't need to ask a lot of questions to know the exact site or even to know how the patient feel. But in telephone consultation, the patient is in front of you, so you need to ask more question, more specific question to get the exact point about the main problem and to get the exact diagnosis. Also, apply this to other station, like if it is breaking bad news, so try to be to show more sympathy and the empathy to the patient. Try to signpost enough because the patient isn't in front of you, so you can't see how he is feeling, or is it shocking news for him, or so try to break the bad news in a good way, and we will talk about it later on. Also in medical error, so in different station, put this point into your consideration. Also, he isn't in front of you, so you may need to examine the patient. So don't hesitate to ask this patient to come to your clinic to examine him, to complete your assessment. So over the phone, we did the initial assessment. We ask him some initial question, but we need to examine him. Don't forget to ask him to come to the clinic. Even if it isn't a medicine station, even if it is built in a bad news station, so it is better to ask him to come to the clinic to discuss this bad news with him. It's better to be in the clinic. You ask him to come for two purposes. First of all, it is better to bring the bad news in the clinic. Also, if he will not come to the clinic, it is like a warning shot. You are about to say something serious. So you ask him to come to the clinic for this purpose. Also, it is irrelevant to diagnose or to give a definitive diagnosis over the phone. We usually will not give any definitive diagnosis. We usually give a provisional diagnosis, and after examination or after reviewing the patient by the senior or the consultant, he will have the definitive diagnosis. So don't give any definitive diagnosis or final diagnosis over the phone. This is an important point you need to put into your consideration if you had this telephone consultation. Okay, what is the approach for telephone consultation? Like any other station, before entering the cubicle, you will read the station, and the important point here is to read the task. read the task. Read the task more and more and more. Try to arrange your ideas and try to know what they need from you in this telephone consultation. Okay, and after that, this is an important point out of Dr. Messi telephone consultation. You need to know if whether you are calling the patient or the patient is calling you, because it will be different. The approach will be different. And if you was confused or confused about this, you may have some fatal mistake in the station. Like if the patient, or if you are calling the patient and you enter the cubicle and you started the telephone call and you did the approach, and after that, so how can I help you? You are calling the patient. You asked one of your nurse colleague to call the patient for you. So the patient, come on, doctor, you are calling me. They told me that you need to speak to me about something. So the approach will be different. Okay. So don't forget to know if you are calling the patient or the patient is calling you. Okay, after entering the cubicle, start by looking into the camera and saying your name and your GMC number is very important. And if you miss to say your GMC number, the patient or the simulator from the phone may ask you to repeat your GMC number or repeat your name, or even if you forgot to say it, he will remember you to say it. Okay, from the phone itself, the simulator from the phone. He will remember you. Okay, after that, in this station, there is only the telephone, the device itself, and the device is automatically put into speaker mode. You will not hang the phone or anything like this. It's a speaker mode, and you will have the chair and table and some paper beside the telephone. This paper could be a test result and also the information, the data of the patient. So you will look into this information, this data, and speak through the speaker. Okay, start your telephone consultation. This is the approach of telephone consultation. First of all, you need to check the identity of the patient. So after starting the conversation like this, hello, this is Dr. Ibrahim, one of the junior doctor here in the emergency in the medicine department, and start your conversation. How can you start your conversation? It is better to ask the patient about his name. If you cannot spell the name, don't try, because you may spell it wrong. So check the identity by asking the patient, can you please tell me your full name? Can you confirm your full name? And your date of birth. It's like you are calling your bank, so they ask you about your name and your date of birth, not your age, your date of birth. And also the registered address. This 3 points will be written in a paper beside the phone, okay? So look into this paper while the patient telling you his name, his date of birth, okay, right, okay. So after that, there is a different question. First, why you check the identity? Because the patient or his brother could be the one who respond to your telephone call, his father. So you need to confirm is the patient himself. Okay, there is some question you may add to the station. Is it suitable time, especially if you are about to break bad news or tell him about something could be serious? Is it suitable time? He could be at work, he could be driving. Are you driving right now? He could be busy with her child. So is it suitable time to talk right now? Do you want me to call you later on? And also you may ask for a number in case for emergency calls or this line cut off. So you may ask for another number, or if it is the suitable number to use as the line cut off. Okay, now start your consultation, and till this point, you finish the approach for telephone call itself. You will start the specific approach of the station itself. If it is medicine station, ask the patient about his complaint. One of the station could be like he sent you a picture of the lesion over the email, or he came to the clinic and didn't find you, so he's calling. He left the clinic and he's calling you. So ask him about the complaint. How can I help you today? If he's calling, how can I help you today? If you are calling him, it will be different. So I understand that you came to the clinic 2 weeks ago because of blah blah blah. Can we have a little chat about what happened or what you have been through, or can you tell me more about? So it is different. And according to the station, as I mentioned, if it is medicine station, ask him about his complaint and start to analyze this complaint and what the differential and any question you need to ask the patient. And don't forget to ask him to come to the clinic to complete your assessment by examination and doing some initial investigation. Okay, if it is breaking bad news, start also the approach of breaking bad news. If it is medical error, start the specific approach of medical error. So we will do videos in each topic later on. Okay, there is some tips to do in telephone consultation. Many doctors complain about the voice of the patient. He can hear the voice. Okay. So don't hesitate to ask the patient to lower his voice, to repeat again. Okay, it is better than to assume that you hear the patient and you know what drug did he tell you about or something like this. Ask him to repeat again and again and again. This is normal. This can occur in the clinic. Deal with the whole situation as it is telephone consultation in the hospital. Okay, so take it easy and ask him to repeat what he said to you again. Even if you have a problem to hear the voice and you can't hear the voice completely, ask one of the organizer to come and solve this question. I know a lot of doctors recently that they told the organizer that they can't hear the voice of the patient, and they spent like 3 minutes not hearing the voice. So they give him a second chance after all doctor finishes the exam. They give him a second chance to do the same station again. Okay, after he finished the station, he give him a second chance to do it again. So don't hesitate to ask for like a solution for this problem. It is better than not hearing the patient and failing the station. Okay, hope you benefit from this short video, and we will do videos about counseling and medical error and medicine later on. I wish you good luck.